What's up, guys? Dr. Dan over here at Turack Chiropractic. Wanted to talk to you a little bit about some of the IgG food sensitivity testing that we do. So a lot of people come in here with mainly a lot of skin issues, right? Eczema, dermatitis, psoriasis, chronic dry itchy skin, hives, different things like that, right? And as well as digestive issues, so gas, bloating, cramping, indigestion, constipation, diarrhea, distended abdomen, number of different digestive issues, right? Some of that has to deal with your microbiome, right? So the health of your gut bacteria. We talked about stool testing that we do. But a lot of that may also have to do with different kinds of food sensitivities that you have. So food sensitivities affect a number, so many people nowadays because of overly processed foods, chemical additives, a lot of issues with glyphosate, Roundup now that's caused a lot of GI inflammation, right? So one of the tests that we do here is called the IgG Food Sensitivity Test. And we use a couple different labs here. I'm just showing you Genova's test here. But this is a test, it goes through 87 different foods. There's also an IgE section, right? So if you go to an allergist and they do a skin prick test, that is for an IgE mediated reaction, which is an immediate sensitivity, right? So if you get stung by a bee, you instantly swell up. That's an immediate reaction. Lots of people have chronic toxicity, right? From the air that we breathe, the stuff that we put under our skin, as well as the foods that we take into our body. So IgG is another method of your immune system to get inflamed, another round of inflammation that a lot of people have or can develop a number of food sensitivities with, right? So IgG is referred to as the delayed hypersensitivity response, which means it can take anywhere from 3 days up to like 7 days to experience an inflammatory condition flare up from a food that you ate, right? So a lot of people have done elimination diets where they've cut out all the big, the big stressors like peanuts and dairy and wheat and stuff like that. And sometimes that helps a lot, which is awesome. It's the most cost-effective way, absolutely. But in certain cases, there's a lot of people who have so many food sensitivities that they're continually eating good foods, but they still might have a sensitivity or a low-grade chronic inflammation or inflammatory response to that food. So this is IgG. This is what an IgG food sensitivity test looks like. On this specific test, there's 87 foods. We use a couple different labs, however, depending on insurance and what patients can afford if their insurance doesn't cover, because sometimes it does cover some of these tests. And from this, we can get a nice graph of if you have a very low, or even up to a high sensitivity, right? So if you're highly sensitive, like on this sample test, it says cabbage, carrots, and celery are very highly sensitive. We're going to cut those things out of your diet for anywhere from 3 to 6 months to help reduce the inflammation that you're putting into your body that's stimulating your immune response, right? So if you've got any number of skin conditions like eczema, dermatitis, itchy skin, dry skin, anything like that, we recommend this test, typically in conjunction with the stool test that we explained in the previous video. So if you have any kind of chronic inflammatory issue, whether it's related to your skin, your abdomen, or your GI tract, right? So gas, bloating, cramping, indigestion, constipation, this is a test that will help you to feel better along with the stool test. Give our office a call or check us out on the website, turackchiro.com, if you want to learn a little bit more about the IgG food sensitivity testing that we do here. We'll talk to you guys later.